and drug cards. Okay, I will now be starting. Okay, so when completing medication administration, first step is wash your hands. Now I will be comparing the first 5 rights. So I have Kathy Means on the physician's order, Kathy Means on the MAR, July 25th, 1960, July 25th, 1960, and health number is the same doctor. Perfect. So now I will take a note that she does have an allergy to codeine, but I will make sure to recheck that at the bedside. So now, doing the first check on the medications, we have ibuprofen, 400 milligrams, oral route, once a day at 9 o'clock. Okay, now we have furosemide, 20 milligrams, oral route, twice a day, and we'll be doing the 9 o'clock dose. Now we have timolol, 1 drop, 5% for the dosing, right eye, and twice a day. So we will be completing the 9 o'clock administer. So now that I've done the check between the physician's order and the MAR, I'm able to put the physician's order aside. So now we're going to have ibuprofen. Perfect. So I will be pulling the bottles. This is furosemide, ibuprofen, and timolol. So ibuprofen, the 400 milligrams. So for ibuprofen tablets, it's 200 milligrams a tablet, so we will be using 2. Oral route, these are oral tablets and once a day. The reason the patient's getting ibuprofen is because it's for her pain. Ibuprofen is an NSAID. It is a non-selective COX inhibitor on COX-1 and COX-2. The safe dosing is 200 to 400 milligrams, so this is in the safe dosing range. And I will make sure that I monitor her pain levels and blood pressure. So furosemide, 20 milligrams. So 40 milligrams. I will be needing half of a tablet for this dose. Oral route, twice a day. Okay, perfect. Timolol, furosemide, I will be using for her edema. So furosemide is a loop diuretic, and what that means is it inhibits the reabsorption of sodium and chloride in the loops of Henle. Also works on the nephron. So the safe dosing range is 40 milligrams to 60 milligrams, which is in the safe range. And I'll make sure I monitor her weight, ins and out, blood pressure, and if the edema improves. Timolol, 1 drop, 5%, to right eye, and twice a day. Safe dosing range is safe, and I will be giving this for her glaucoma. Now, timolol is a beta blocker, and it works to decrease the aqueous humor in the eye. So, for this patient, I will be giving 1 drop in the right eye, and I will definitely be monitoring for pain, reduced swelling and pressure, and if there's any symptoms. So looking at the bottles, I checked that their expiration dates were incorrect dates, so they were all good. Now I will start to prepare the medication. Okay, so for ibuprofen, we know that we do need 2 tablets. So ibuprofen, 400 milligrams. Now creating the label. We want to do the labels right away because we don't want to have a bunch of containers on the medication tray. So we will be writing the patient's initials at the top, drug name, ibuprofen, dose, she's going to be having 400 milligrams, volume, she's going to be having 2 tablets, concentration is 200 milligrams per tablet, date and time, it's January 6th, it is 8:45, and signature SRUMSN2. And we will make sure to attach that right away. but not putting the bottles back just yet. Now we will be doing furosemide. So we know we need to cut the tablet in half, as the dose is 20 milligrams and the tablets are 40. I will be cutting the tablet in half. I will be putting the store tablet. Now I will be writing the label. Caffeine, drug dose, furosemide. Dose is 20 milligrams. Volume is 0.5 tablets. Diluent, no. Concentration is 40 milligrams per tablet. Date and time, Jan 6th, 8:45, and signature SR UM SN2. All right, now for Timolol. Caffeine, drug name Timolol. Dose is 5%, 50%, and we will be doing it. Volume is a drop. We'll make a note that it is the right eye. Concentration is 0.5% per drop. And signature date and time. January 6, 8:45, and my name SR SN or UMSN2. Now I will be performing the MAR to the prepared medications to the bottles. So we have ibuprofen, 400 milligrams. We have a 200 milligram tablet, so 2 tablets, which equals 400 milligrams. We have the oral Rheault. It's be given once a day, and the right reason for pain. The furosemide, 20 milligrams, 40 milligrams. So we will be splitting a tablet, which the tablet is split, so that is good. It's be giving orally twice a day, but we will be giving the 9 a.m. dose. And the right reason for her edema. And we will be giving Timolol, 1 drop, 5% to right eye. Looks all good. This is for her glaucoma. Right reason, right route, right dose. Okay. So after doing my 2 checks, everything looks right. I will be now putting away the medications. And grabbing a cup of water. Cotton ball. Gloves. My drug cards. And I will now enter the patient's room. So, entering the room, I'm performing a general safety check. Bed rails are down, patient's lower to the ground. No mess, nothing, that's all good. Hello, Kathy. My name is Solaye. I'm going to be your student nurse today. How are you feeling? Good, that's good. So, I am going to lift her up so I don't strain my back. And you will lift the head of the bed. So, a high Fowler's position to help the patient digest the medication they're about to receive. Okay, Kathy. Could you tell me your birthday, please? She says July 25th. That is great. And your name? Kathy means perfect. I will be now assuring that she does have that codeine allergy, as you see on the bracelet. I will be looking at health number to health number. Perfect, right patient. So Kathy, I see you have an allergy to codeine. Do you have anything else you're allergic to? She says no. Good. So to start, I will be performing vitals. So I'm doing blood pressure, temperature, oxygen, pain. So Kathy, for your pain, what type of, on a level of 1 to 10, where do you feel your edema pain? She says 7. And what about the pain from your glaucoma? She says 5. So I now know that her pain levels are a little bit high. Okay, Kathy, so I'm going to be administering some medication today. So first we're going to be doing ibuprofen. So ibuprofen. I will be doing the third check. So ibuprofen, 400 milligrams. Oral tablets, perfect, once a day at 9. Okay. So Kathy, I have ibuprofen here for you. It is a COX inhibitor, which means it circulates through your blood to help decrease the prostaglandins, and it will help with your pain. So if you feel stomach pain, cramping, dizziness, any of those, let me know, okay? When you're doing this at home, just make sure you do take it on an empty stomach. It will work faster. But if it does cause upset, make sure to take it with milk or food. So I'm monitoring her pain levels before, which she said it was a 7, and for her eye it was a 5. So here I will be giving you the medication. She takes the medication. And here's some water. Perfect. So make sure the medication went down well. Ask if it's all good. She's good. So I will be moving on to the next medication. But before I move on to the next medication, I will document. Today is the 6th. It is 9 o'clock. So I will be doing SR, UM, SN, 2, and the time. So I won't write that big in a normal setting, but I'm nervous right now. So 9 o'clock. Perfect. So Kathy, I will be now giving you furosemide. So what furosemide is it's a loop diuretic. So it is for your edema, the edema in your legs. So what it's going to do is it is going to inhibit the production of electrolytes to help decrease that swelling. So if you feel any nausea, any fast heartbeats, or diarrhea, please let me know and we will review the medication. So, there you go. And the water. Perfect. So for this medication, we will be monitoring her ins and outs, her weight before, and her blood pressure. So I checked it before. It was a little high, so we will check it after. I can also check the edema. So what you do with that is you put a type of bracelet around the leg and see if it ends up becoming more swollen or if it decreases. So you can tell with the measure. Now we will be moving on to timolol. So, putting on my gloves. So Kathy, I have your last drug, timolol. It is a beta blocker, which means it's going to work in your eyes to reduce the pressure, okay? So for this drug, we're going to want to monitor if you have any pain in your eye, okay? If you have any itchiness, redness, swelling, let us know. Or burning.
Alright, so the first medication I have for you here is ibuprofen. This is a pain medication. It's to relieve pain or if you have any fevers.
Okay, so timolol, 5%, right eye, twice a day, and we're giving the 9 a.m. dose, so we will go ahead and give the dose. So what I will do is I will pull down the conjunctival sac and drop the dose. Kathy, I'm just going to ask you to look up while I perform this. So she's going to look up. Instantly after I give, I'm going to put pressure on the lacrimal duct for about 2 minutes so the beta blocker doesn't go systemic and affect her blood pressure, as it should be normal because she has no pre-existing heart conditions. So I'm just going to ask you to look up, Kathy. She looks up and make sure it's the patient's right eye. Apply the drop, instantly apply that pressure. Is that a good pressure? She says yes. Okay, 2 minutes go by. Okay.
Next medication I'll be given is
I remove my gloves and throw them in the garbage. I will finish documenting. So 9 o'clock. SR2. 9 o'clock. On the dot. Perfect. So I just documented for the patient. So Kathy, how are you feeling? She says good. So I am going to leave you up in this position so you can digest the medication. So when you do some of these medications at home, ibuprofen, you're going to want to monitor how it feels with your digestive tract. For the timolol, you're going to want to not share the bottle with anyone else and be sure to not touch the dropper. And make sure you do apply that pressure, if you can, on your tear duct. And for the furosemide, what you're going to do is you're going to make sure you monitor the effect it's having on your edema. So, I'm finished today with the medication. Can I grab you anything? Are you comfortable? She says she's comfortable. So I will now gather up. I now notice I forgot to clean my hands after removing the gloves, so I remove the gloves and clean my hands. Okay, Kathy is comfortable. She's in a high Fowler's position. So Kathy, if you have any of those symptoms from the medications as I mentioned before, please let me know. The call bell is just in your reach. Don't hesitate to call if needed. I will be back in the next 20 minutes to see how you're doing with that medication, okay? All right, thank you, Kathy. So I close the thing and instantly wash my hands after leaving the room.